Thank you so much, Madam Chairman, and thank you so much for holding this hearing. You know, there's been a lot of talk about what could be done at the federal level. Well, fortunately, our new president, Joe Biden, announced right away a whole package of things that the federal government could actually do. And I just want to say, state and local governments are having a hard time. Yes, some are doing better than others in terms of the COVID pandemic. But the truth of the matter is that in the big COVID relief package, I'm happy to see that the President of the United States has understood the plight of state and local governments who have lost their revenue because of the economy virtually shutting down, who have had trouble just making the trains go and helping their healthcare workers and their first responders to have enough money. All of the costs of or most of the costs anyway, of the pandemic have fallen on local governments, not-for-profits. And fortunately, our president has said that the big package, the 1.9 trillion, is going to address the needs of state and local government. And what have we seen from the Republicans? No, a fraction of that, and to take out all the money to help state and local governments. And so I wanted to ask Dr. Ezike, and thank you, I want to thank you, Doctor, for coming today, for the work that you're doing to try and help all of the people in the state of Illinois and to get vaccine where it needs to go. If we were able to get more state and local help, how do you think that that would alleviate some of the problems that we have been seeing?
Thank you so much, Congresswoman, and thank you for your continued support along this pandemic journey. So we know that the expansion of the network will increase the reach. That means that more people will be able to access. That will give opportunities for mobile vans to go to hard to reach populations. That will allow people to focus and have a specific pod for seasonal workers or migrant workers. So the expansion of efforts, the expansion of the network just allows the reach to get more corners, every nook and cranny of our state, and to get it quickly, and also apply that equity lens so that we're clear and intentional about the groups that are often left behind, that have been left behind, to intentionally go after them, both with the appropriate messaging, the appropriate messenger, and the appropriate language to be able to get those people on board as well.
Thank you. You know, I have focused a lot on the elderly since I've been in Congress. And it is so important that we're able to get the vaccine to older Americans. And I know that in Illinois now, we're in 1B, that is that people 65 years old and older. But we have seen some difficulties, and I've certainly heard calls from at my office of people of that age and way more that are having a hard time just navigating the system. And I'm just wondering what kinds of things that that you are doing and that the state is doing to make sure that our older population is having access to the vaccines.
Congresswoman, for that important issue as well. We know that everyone is not able to use the internet and to access vaccines during that way. And so all of the local health departments are being encouraged to use resources to expand the phone line so that there can be people that can call and have that warm hand to help them through it. People are creating waiting lists of people who are trying to get the vaccine, and then reach out personally and help schedule that vaccine so they can call back with an actual time. So we need more people, not just vaccinators, but navigators and community organizations that can help with identifying people who have to get the vaccine, that can't do it through the traditional methods that have been established, and can be led to the vaccine, and including using the additional resources that are needed for even transporting people who want to get vaccinated to the site. So all of those things are part and parcel for getting our most vulnerable populations vaccinated as well.
And all of those things cost money to do, and I'm looking forward to some help from the federal government as well. Thank you, and I yield back.